Live as we go. Welcome back to Tuesday training. We are wrapping up the month of August here, talking about calibration and assessment and all things good in the world. I am so delighted to invite you guys into another fabulous hour of community sharing and up-leveling ourselves. Hello to those of you who are joining us on YouTube. I can see us live, which means I can also see the chat. So please feel free to join us in conversation in the chat if that would serve you. I am going to serve you for the next hour. Welcome to those of you who are new here. I know so many of you have joined us in our YouTube world in the last week or two. So, warm welcome to all of you. I'm so glad that you're here. If we haven't met personally, I am your host for the hour. I am Gina Schatz. I am an orthopedic bodywork specialist. I started as an LMT with a bachelor's degree and all the good things. But the most important part about that is I still work clinically, and I have for 33 years. And so, what I like to share with you here on Tuesday is the anatomy that I know is needed to be able to create great clinical results. And so that's what we do here every Tuesday at high noon Eastern. So, welcome to those of you who are here. I'm excited. Just a programming note, I did get some inquiries about this, and I recognize where there might be an opportunity for some clarity here. Tuesday trainings, which is where we are right now here. If you're watching this live or on the replay, you are in what we call Tuesday training. My lovely beings who are here on camera with me are in the club seats, so that in our members club, you can come and work with me live on camera, and we do that just before we come live here on YouTube. There's also a couple other places where there is content, and I recognize I was getting some questions this week. So here on Tuesday training is free. You don't have to pay for it. Club seats, obviously, those folks are members, and so there is a membership with that. It's nominal, and you can also join our membership for 7 days and just check it out with no obligation to pay or stay. So that's also happening. In that club, we also have monthly coursework where we go through an entire anatomy course together, and I'm in there with you to help you and support you. And there's also a ton of other training that's in that membership as well. Hey, Debbie, nice to see you here. Glad that you're here. I also do send out newsletters. So if you're not yet on our email list and you want to receive written and video trainings in your inbox, please do join us there. We have just spent a lot of time moving over our email system. So that's all clean and glitch free, as we love to brag about. So please do join us there if you want some trainings in that way. And there are opportunities to train live with me. And I don't talk about them often, but we do have an in-person workshop coming up in January where anyone's welcome to come and train with me in person. It would be obviously a destination and you'd need to make considerations for that. But live and in person we're back at it, guys. We get to be we get to be real and human and engaged. So I'm excited about that. And then we also have our annual retreat. Hey, Cheryl, for Schatz Method practitioners only in the Schatz Method Mastery community, and that program is an annual program. So you probably hear us talking about that program and then thinking that everything else is in that program. And while it is, there's also other places to gain some training and some support that way. So let me know if that was clear, if that helped you answer some of the questions. I know I got several emails in the last week or two, and I wanted to just put voice to that so that you know where to get your training needs met. So I do train practitioners, and especially given the new information we have, I want to really emphasize that it's not just training in anatomy. And that does follow us here on Tuesday trainings. While the content here is anatomy on Tuesday trainings, my mission in the world for all of us as a community, whether you're a Schatz Method practitioner or not, is to really up level. I've always been that way. I've always been that person that I want us to strive and thrive. Absolutely. And that requires, focus in a couple places. It requires high level skill, depth of knowledge, confidence in implementation, and those three are very different. And it also, now we know, requires an expediency because we do have new considerations. Technology is adding a layer that we've not needed to consider up until now. And now we do, and so we're still going to go. And my position on that is still to get us to strive and thrive, always. So that's where my voice is, regardless of what actual content we're focused on for the day. So again, today we're going to talk about calibration and assessment. And that is our last lesson in our coursework, Inspired Beyond Anatomy Level 2, which is really about the implementation of being a practitioner, manual and movement practitioners alike. That course is currently active in our club. So all club members have access to the entire course for the month. And then, of course, next week is a new month. So we are moving on to another very exciting topic. But I want to just stay here on calibration and assessment and also add our new focal point of what that means in current day, right? So here's what I love about anatomy and progression. Everything in that course, all the anatomy in that course is still accurate and up to date. So the good news, I'm not a researcher except for my own clinical research, which I always report back to my practitioners. But I'm not a researcher like under a microscope and coming up with that level of research. But I do understand evidence-based and I'm here for it. The reason I'm bringing this up is the content that's in the coursework that I offer I believe is timeless because it's the body, it's the parts and how they work. And for the most part, that doesn't change. We learn new details and new nuances, but we're not like, oh, wait a minute, it's not called the femur, it's something else. We're not there anymore. Like we're way advanced. So the coursework is timeless. And what we do with it gets to continue to be updated. And that's the benefit of being live and current, right? Like live with me every week while we're here, because then I can bring in the new lens of that. So similar to what we did last week when we talked about the nervous system and I had this new viewpoint, because literally I had just had this worldly experience or worldly, real world, well, that was worldly, real world experience. There's also more information about assessments and calibrated touch. And it's not the first time we've talked about both, even here on Tuesday training. If you want to listen to last year's conversation on this or 2 years ago, you'll find it in the YouTube channel. We have hundreds and hundreds of videos. Just type in the title and it'll probably pop up for you. Repetition is amazing. It's how we learn, and you can get that in that training. I want to give you a new viewpoint about calibration and assessment today, given where we're at right now, currently in real time. So calibrated touch as a phrase we use in our mastery practitioner program for both manual and movement practitioners. Now, hold on a second if you're getting a little bit nervous about that. All manual practitioners get to calibrate their touch, and that is a lifetime experience. It doesn't change once you get, quote, good at your manual skills. You continue to update that. So just keep that in a frame of reference. Would you agree with that, Gary? That we get to keep, yeah, absolutely, right? So we get to keep updating our manual skill and our calibration of our manual skill the whole time we're manual practitioners. It matters to movement practitioners here in a couple ways. Sometimes movement practitioners think, well, I don't know how to do that because I don't do that. But there's a place where you get to. Other times, movement practitioners might believe that manual practitioners have a leg up, and manual practitioners might forget that we also get to keep revising that and updating that. So the point of what I'm trying to make here is that we're all continuing to evolve all the time. Even with calibrated touch, you don't have to be a manual practitioner to need to calibrate your touch. What I didn't say is that you then get to be a manual practitioner. I'm wildly against that. Don't do anything out of your scope. Just like we said last week, don't be armchair psychologists if you're not. And so don't be a manual practitioner if you're not. But you are still making contact with, as a movement practitioner, you're still making like tangible contact with the people that you're in service to. At least most of you are, maybe not all. But if you're a yoga teacher and you're offering assists, you're touching people. If you're a trainer and you're offering alignment-based, instruction and you're touching someone to move them in a certain place, you're touching them. So we need to calibrate what that touch is. And of course, the type of touch and what you're doing, whether you're doing a full session of manual therapy or you're offering a hands-on assist, clearly that's different manual practices, but all of us get to calibrate our touch in whatever manual touch we're doing, whether it's a hands-on assist or a full body session. Okay. So calibrated touch in short means while we're thinking about the nervous system, what does it feel like to the person on the receiving end of your calibration? What does that feel like to them? And the answer to the question lies with the nervous system, which we talked about last week, and it's in that lesson in the coursework. What we get to know about is sensory receptors, motor receptors, all the different parts of the nervous system, because that will inform you, just inform though, that will inform you on what you need to then adopt as a skill, separate from knowledge, on how you touch with whatever type of manual touch you're offering in the types of sessions that you offer. Does that make sense? Yep. So whether you're manual or movement, you're still doing hands-on. Okay, great. So in calibrated touch, one of the things that I want to emphasize today that's different to the information I already offered, which is repeated, is that when folks are in pain, because that's where we're at, that's in our lane, when folks are in pain, their nervous system is now wired differently or acting differently. Let me be really clear. It's acting differently in its wiring than it acts when they're not in pain. Let me say it again. When someone's in pain, their nervous system is acting differently with its wiring than it acts when it's not in pain, when they're not experiencing pain. And that is the connection between the nervous system and the endocrine system as they are yoked in the hypothalamus. And your brain and your hormones are literally in concert with each other, and they are triggered in pain. They're also triggered in happiness and pleasure and things that feel good. So your chemical hormones, your chemicals and your hormones are like your best bartender. They're like serving up cocktails and changing your mood at every turn. So once you know the nervous system and you know how your person that you're in service to is calibrated for touch, which is based on the nervous system as a whole, the uniqueness of the person in front of you, and then you get to add another consideration, which is how much pain are they in and how long has the pain been there, because that's changed their nervous system. It just has. You guys can probably notice this, that last week, did anybody notice last week I was kind of pale on video? Did anybody notice that? Or you just all being nice? Well, I noticed it, and I was sitting in front of a window to try to get sunlight on my face because I could see that I was pale. I was in so much discomfort, and I had been for so long that it was literally changing my face, even though I was present and awake and obviously communicating. I've luckily, knock wood, had a few days where my pain level has dropped significantly. And now I'm in a room with only one window that doesn't actually have sunlight. It has sunlight coming in it, but it's a stained glass window, right? So the light is even more diffused. And even someone on my team, as soon as I logged onto the internet to meet with them, they said, "Oh my gosh, you look so much better. You look vibrant." Because that's what happens to our physical apparatus when we have the presence of pain or when we are in the absence of pain. It just changes everything, especially the nervous system. So as you learn about the nervous system and what that means about you and how much you touch or don't touch or how or what the reception is, then you get to learn about the person in front of you because that might be different. Some people like deep tissue massage, some people don't. Some people like the feel of wool sweaters, some people don't. Everybody's sensory receptors are different when they're working well. And then you get to add on the layer of when they're in pain, what the heck just happened here? And that's a different level of knowledge and a different level of skill. And some of that requires some delicacy, right? We talked about that last week about your nervous system being frayed. The other thing about it too is that your best point of entry is to be in a very parasympathetic state when you're in service to someone who's not. And when they're not, you're not the reason. So that was another thing that came up, like, oh, I'm really stressed and she triggered me or she this or she. No, you don't trigger people. Their triggers are activated. It's not the same. So if you're one of the practitioners that tends to get a little bit of nervousness, a little bit of spook, you don't come with that authority that I want you to have, not authoritarian, but the authority of like, I know the nervous system. I know how this is being projected from my voice, and I also know how this might be being filtered by their receptors. When you can come with all of that and you have skill in how to navigate that, then you're more confident. But if you don't have skill in any one of those places, you'll be a little bit weird, and your client who's in pain will bark at you, and then it'll just be a whole thing. And then there's transference and countertransference, and you're both off to the races, and nobody helped anybody. And that is my loves. That is the rookie move for from a practitioner. If you're navigating folks with pain, it requires sophistication from you in your knowledge and your skill and your implementation and your ability to assess in the moment. It's a constant learning. It's a constant learning. For example, one of the ideas that we go through, well, I shared, let me finish one thought and the sentence that goes with it. One of the ideas that we go through in our practitioner training in the Schatz method is we talk about operating systems. On a normal, good, pain-free day, folks take in information and communicate information differently. I took a lot of communication in college and ever since because it's just so powerful. The word choices that we use, how we say them, it all matters. And you guys have heard me say that I recognized a lot about my teaching when I would get rushed for time and I would like the room would move, shift energy, and I didn't know what that was. So I started recording myself and I would listen. And every time I'd start to run out of time, my tone would change. But I wasn't recognizing that was happening. So I was creating the angst that I thought they were bringing, right? So you got to like know who's who. Are you bringing it or are they bringing it? Here's the answer. It's always you. It's always you because you can't control anyone else. You can't make them triggered. You can't make them not triggered. All you can do is run you, and then they can only run them. Nobody's triggering them either. They're choosing to be triggered. So it's all a self game. But when folks are in pain, that doesn't compute. You're not even going to have that kind of a conversation with someone when in that much pain. You guys have probably recognized this, right? When someone's in great pain, someone you're in service to, or maybe a family member, and you're having just a regular conversation and they're really rubbed. Do you guys ever recognize? I just had a conversation with someone I deeply care about, and like nothing I was saying was getting through. It all just felt like pressure to them. And I was like, but why? I'm literally caring for you right now. Why is that pressure? Because the pain was masking what they could hear. And I still get to be responsible for that if I'm the communicator and not get then doubly rubbed backwards and then let my triggers fly. So all that to say, when folks are in pain, if those are the folks that you're serving, and certainly if you're training with me, you are, that comes with sophistication. The way you communicate, the way it's being heard, how it's being interpreted. You can't control anybody's hearing, but you do get to be very advanced in what might be being translated, and then come with a follow-up so that you can connect in the middle and still be in service. So sometimes what I've heard early on in our Tuesday training days is, well, my client this and my client that. And you guys don't say that anymore. And I love it because we put the kibosh on it and we just don't get to finger point at our client. Well, they came in really upset, or they didn't do their homework, or they wanted me to hang the moon, or whatever. Part of that is their pain talking. And it's still our responsibility to navigate all the flood that they bring without taking ourselves out of the game so that you can actually be in service. And when you start blaming your client for how they're showing up, you've just basically said, I'm ill-equipped to help you. You haven't actually pointed out their behavior. You've just surrendered to your own skill or lack thereof. So just notice that when folks are in pain, the stakes are higher. You get to show up better than just book smart, way better. That's how you navigate them. That's how they feel safe. That's how they feel seen and heard, and then ultimately supported because you can move through that and create results for them. So as we're calibrating touch and recognizing the nervous system, we're also calibrating everything. How you touch them with your words, how you touch them with your tone, how you touch them with your energy. And you still can't control their response to it, but you get to know that there's going to be a response to it if they're in pain, because that's the nature of pain. That's what it does. You're not talking to the same wiring. The person in your life that took what you said out of context when they were in pain, you would also recognize that they wouldn't have done that taking what you said out of context when they weren't in pain. That's your proof right there. Their wiring is different when they're in pain. And you add medication on top of that, you're not even talking, they're not there. They're just not there. And it's super sad, which is one of the reasons why I really want us to lean into the preventive part of what we do, even if we could just circumvent the decision to get on medication in the first place. If they could just be at that low grade, oh my gosh, I don't think I can take it kind of pain before they jump to medication, we would actually be serving them a lot because they would still be there and available and present to what you're saying. I'm not saying don't take meds. I'm saying it's not my preference that folks be on meds. And in fact, as a manual therapist, we were told that we needed to know exactly what medication they were taking before we even did hands-on with them because they wouldn't feel half of what you were doing. It's why I took pharmacology in my undergrad because I really did need to know like, well, what actually is happening to someone's body and their brain when they're on medication. And so I always tell my clients, don't even take an Advil before you come because it's masking things and I won't be able to get feedback from your body, which is wildly present to your pain, or it wouldn't be changing your chemical cocktail. It's literally involved. So I don't want that to go away. I want to know what we're navigating here so we don't cause more pain, more pain. Hi, Sophia. Glad you're here. Okay, so calibrating touch is calibration on all things, and it changes once pain is present. That's the bullet point takeaway on that first topic. Yes? Got it? Okay. Assessments. I have so much to say about assessments. I wish I had more than just the time on the clock. Whew. Okay. Some of us think assessments, let me say this differently. Sometimes when we hear the word assessment, what comes to mind is the actual physical assessments that you do. Raise this, do that, turn here, lift that, etc. And that's true. Yes. Yes, absolutely. The assessment conversation I want to have today is more about the assessment at the start of their session before you do that type of assessment. Meaning your subjective intake, which we have talked about here at some length, and we talk about it for multiple years in the Schatz method community because there is so much value in that subjective intake. What your client and patient offers you at the very beginning is so valuable that most of us miss really important details about what's actually going on. We also miss the opportunity to have the treatment plan spelled out for you. You don't have to work so hard. If you know what you know and you're skilled at it, all you got to do is listen and they will tell you exactly what needs to happen. And you're like, okay, I just heard it. This is what needs to happen. And that is a skill in itself, just to be able to listen like that. And mind, Cheryl, you're nodding because we've just done a training on this. Yeah. And there's so much gold in there, and it just takes a bit of time to practice that. Part of the time that's involved is your own filter while you're listening. So we just talked about that with calibrated touch. But when you're listening in a treatment space with your client and your nervousness is low grade chirping, you can't actually hear what they're saying. You're clouded and you're not even in pain, still clouded. There's like someone else talking in your ear and someone else talking in that ear, and you can't quite make out who's saying what. That is skill based. You get to practice that. You get to be drilled on your subjective intake. Like I drill my practitioners. What did you hear? What did that mean? What's the implication of that? What's the implication if that doesn't happen? You made up a decision based on what? These are the kinds of skill sets that I want us to all have so that you can be clear and only listening when someone's talking. And most of us believe we already are until we go through this training of your subjective intake. And I can hear things that other practitioners don't hear. And I'm not bragging. I'm just saying like I'm more present. I've got more practice at it. So I can be more of an open vessel. I also have really taken myself on what does this all mean? What's the implication of this mechanically? And I've literally walked it through. And that is the challenging part of listening, what you do with the information you've heard, And my experience is that for practitioners to really get that, they need to be held accountable to it. Like they need me to be, challenging them on that. If you're able to do that on your own with and actually hear everything that was said and not miss a beat, then good, amazing for you. And then you get to take yourself on and well, what's the implication of that? And don't make up an answer. That's the default with some practitioners. You're like, I got it, Gina. I got it. I don't need you. All right, except that you just made up a story that's not actually with what they said or how the anatomy works. So how about we just be honest about where the gaps are? And again, strive to be really excellent. And I don't mean to say this in a way that sounds derogatory in any way, guys. I mean it to say it in the most humble, supportive way possible. For you to really be a specialist and have a niche application of who you serve and the results that you create, you get to not mistakenly think that you've got the answers. It's almost the opposite. You got to believe that you don't have the answers and you've got to strive to get them, which is not the same as let chatter go on in your head and not hear anything and be hard on yourself. What I mean is like, don't imprint client A with client B. Don't imprint what I said worked for me one time on your client that might be coming in next week. Don't do that. Be really clear on who's in front of you and exactly what they're saying and exactly what that means, which requires you have to have a lot of knowledge in you that you can call on and then synthesize. So knowledge in a workbook is not the same as synthesizing that knowledge. It's totally different. It's totally different. And I know that because I hear that from my practitioners. They come through level one and they're like, I got it. I got your method. Makes total sense. Okay, wait, what do I do? Wait, what's exactly, and that it's not a dig. That's just part of that's part of the skill of really synthesizing what you know. If we just came in book smart, we would be so dry that we wouldn't actually see the person in front of us and we wouldn't hear them, which would mean that we probably wouldn't be asking them questions either. Part of why we don't ask questions is because we don't know what to do with the information they give us anyway. Another reason why we ask questions is because we're actually filling gaps because we don't know what to do. So we're going to make the client talk and fill time. If you catch yourself doing that, this is what I mean. Just be humbly honest that you're doing it and strive to do something different because that means you're not acting like a specialist in that moment. You're skirting. And if you want to be excellent, you'll recognize when you skirt and you'll take yourself head on so that you stop doing that. That's what I meant when I said, assume I knew nothing. Take myself head on. I need to know all of this right now. And then do it again, and then do it again, and then do it again. And so you're like, I actually do know it. I got it, which takes some time. Not forever, but it takes some time. It doesn't happen in a weekend workshop, and it just doesn't. Okay, so assessments, back to subjective, everything that they're sharing with you has gold in it, or they wouldn't be saying it. Your job as the specialist is to know the nuances and the meaning about what they're saying and their implications. And then once you have that kind of clarity, then you get to have the skill and what to do about it. Specialists have a lot. They have a lot. Now, as it comes back to current day and assessments, as you know, I've been playing with my physical therapy robot. I got a phone call yesterday that said, hey, you haven't logged in and we want you to keep going. And otherwise, we're going to take away your device. Okay, fine. I'll still play because I want to learn what this robot's learning and I'm going to give it no information anymore. Okay, cool. So it's giving an assessment of what it thinks I'm doing. And here's a really interesting part. I know about optimized alignment and how optimized alignment optimizes function. That's literally the name of my game. And I will be in front of this camera that's literally got a whole view of my body and it's got lines on me, like it's assessing where I am in space. And it'll ask me to do something and I'll distort some of my alignment somewhere else, which would actually challenge the work that they're asking me to do, and the device won't pick up on it. Which means I could, if I didn't have enough information, I could hurt myself with that device. Now that might sound really reassuring, like, oh, good. So see, the device isn't as good as me. I can't be replaced by a device, except that we've got to remember this, guys. These devices are doubling their knowledge and information and skill every 3.25 months. So if we want to outpace them, or at least stay in line and not get bombarded and overridden by them, that means that we must be doubling our knowledge and our skill set every 3 months, or we will be outpaced. It's just what's happening. So again, if you're freaking out and you're like, oh my God, Gina, you're triggering me. I'm not triggering you. You're not listening and wanting the information to motivate you. So this is what I'd like you to do with that information, which is where I'm at. And I'll share this with you because it works for me. I want where I'm at and where I'm going and the space in between to inspire me. I don't want where I'm at to panic me or make me righteous or arrogant, or where I'm going be completely daunting. I want the gap in between to inspire me to go there. All that's going to happen as a result for me is I'm going to get more excellent than I already was if I follow the math. There's nothing to fear there. That's awesome, actually. Let's go. Let's freaking go, right? If that's not your response to that information, check yourself because it's going to keep evolving. And you have the option to evolve too. The difference is that that's a bot and it'll evolve because the program tells it to. You're not a bot. You'll evolve because you choose to or not. And if you choose not to, then you get to be really right about how much you're struggling. And then you're back into your own sympathetic sauce. And nobody did that to you. You did it to yourself. So we don't have the luxury of time like we used to, but we've never really had the luxury of time. Because every time we delayed knowing what we get to know or being really excellent at what we're capable of, every time we delayed up until now, it cost us. It either cost us our confidence, or it cost us the client, or it cost us the cash because they didn't come back. It's always been a cost. It's just that now the parameters are getting a little more narrow. So back in the day, when we still do have annual enrollment in our mastery program, I used to hear a lot from practitioners that would say, you know what, not this year, next year. I'd be like, okay, that's a long time though. You guys, you don't have a year to contemplate and stay stagnant anymore. The skill must double in 3 months for you to stay pace with what the technology is providing people now. That's just the reality. So whatever is on your heart to do, whatever you're afraid to do, is probably where you should go immediately. And do not pass go and do not collect $200. Let's go. Right? It's been our slogan for a while at our annual retreat. We're going. Like we're going. We're not waiting, we're not contemplating, we're not calculating, we're not deciding. We're going. Like actively go. That's always been our slogan, even before I got privy to AI and the timeline. So you get to be going. You get to be really going. And if you're burnt out, this is probably why. You get to assess not just your clients, but assess where you are in your career path right now. Are you burned out because you keep doing the same thing and not pushing the needle on your results or your bank account? Because that's fully within you. You have it within you. You have resources available to you to become the expert specialist that you want to be. And if you say to yourself, well, I did it already. Oh my God, when is it going to happen already? I heard someone say that last week. I'm like, it is not happening. You're the happening. When are you going to happen? When are you going to show up for yourself and hot seat yourself and ask for support so that you don't have to go it alone? When are you going to show up? People are relying on you. You're relying on you to be excellent. That's why you've been here with me for all this time, because you said you wanted to be excellent. Let's go. Time's ticking, babes. We've got this, but we get to dive in now. Get to dive in. All right, I could go on about assessments, but I got my messaging in current day over the band waves. Band waves? I'm making up words. Gary, band, not bandwidth, radio waves. What is it? What is it? Where am I sending the message out? To all of us. I'm sending it out.
It it's your bandwidth. You're right. It's
Bandwidth, but
out.
there's waves like commute teleporting information out into the anyway. I don't want to water down the
Yes.
message. I'm sending it from
Just make up a new word.
I have been known to do that actually. I'm
Yeah.
sending my intention for all of you to strive and thrive from my heart out into the ether so that it catches you in time for you to do something about it and be who you get to be. Become the specialist. Become her and him. Don't wait anymore. Don't put it off. Don't put it off. It'll be too late, and I don't want that. I want it to be exactly timed. I want this to be perfectly timed. All right, babes. What questions can I answer for you today? What questions are on the deck for today? Hi, everybody who's here live. What questions do you guys have? Do you have any questions on anything we've talked about? AI, assessments, calibrating touch, timelines, something else you have a question about? We have several minutes. I'm happy to answer questions. Anna,
Hi.
hi.
Um, One of the things that we touched based on in the coursework that I need to keep remembering is assessment does not equal diagnosis.
Right?
So even something and the importance, of not because people love to identify, what's wrong with me, what do I have? So they love a label, and then that label sort of sticks. And it's the languaging around something as simple as, the mobility test, and you're hypermobile. Not saying that as opposed to saying, well, your score puts you in the hypermobile range.
Mhm.
And so that's something that, for some reason, I have to keep remembering constantly, that the impulse is there to, not that I'm qualified to diagnose, but within the scope of what I know, even something like, well, I think, I think there's a problem with your knee. I think, I have to catch myself all the time. So I wondered if you could touch base on um, the instinct to
Yeah. So good, Anna. I love it. Yep. I have three ideas that I'm going to share with you. And I will start by saying, because I'm lucky enough to know you well from our training time together, that your processor that I mentioned here in training today, the way you process information, we all have a processor. We all have a primary and a secondary, and there's only four. So if we are only processing information the way our primary processor processes, we're very comfortable there. And that means that we're only effectively communicating with 25% of the population because there's four options. So it's helpful to know what our processors are and how we're coming across even to ourselves and definitely to other people. And what I know about your processor, Anna, your primary and secondary together are strong clarity, and there's an exactness to it, which is beautiful for your former life of being an architect, right? And the exactness that comes with correct measurements, etc. And it's also very helpful when folks are spinning and confused and nervous about their pain to be like, and like rein them right back in. Where it doesn't support you and others with that same processor is when we get very black and white and very right about things because we miss the openness that's available that is required in assessments. We must be open in an assessment because it's literally not about you. It's only about the other person. And so that stretch into being open provides more bandwidth in the other processors to be able to take in more information. So that's number one about you specifically. And I'm happy to talk to anybody about their processor. But the three points that I wanted to mention about assessments, you mentioned folks are very happy with a label. So you want to be careful not to diagnose. And what I would invite you to consider instead is that actually nobody likes a label. Nobody likes a label because it's a judgment. It's laced in judgment. And that's from Marshall Rosenberg's communication work, nonviolent communication. He talks about that a label is a judgment and a compliment is a judgment. Because if I say you're beautiful or I say you're ugly, it's still my judgment of what I'm seeing. And nobody likes that because it locks them into that very fixed place. There's no other option there. So, really, what they want when you've experienced that they want the label, what they really want is clarity about what's up. They don't really want the label. Nobody does. And if you just believe that as a universal law of humanity, that nobody wants a label, it'll pause you before labeling and diagnosing because that's not what they want. What they want is the clarity. And so, if you offer the clarity, that's going back to the skill set that I mentioned earlier. Clarity means you understand what's going on, you understand what's gone wrong, and you understand what to do about it. That's what they're looking for. So that means you get to hot seat yourself. Do you have those answers? Most of the time, we don't. So it's easy to just lop a diagnosis across the room then, because then at least it shuts the conversation down. And that's what judgment does. It shuts the conversation down. Nobody's open after that. It's been locked and loaded. And when we get to the diagnosis, when you're saying, assess insofar as what you can treat, you heard that from me. That's absolutely true. Because I also had this question about diagnosing, back in the 90s when I was in school. I was like, what do you mean? Do I diagnose? Do I not diagnose? And that's what the president of my school said. You diagnose insofar as what you can treat. And I kept repeating that over and over again. And I'm like, okay, I got the phrasing, but what does it mean? And what it means is I have the information about how the body's designed, and I also am deeply skilled at when it goes wrong. So I'm knowledgeable and I'm skilled about when it goes wrong. And so I'm the bridge between the two. Because when it goes wrong, curtain number 3, you've heard me call it, my patient is in front of me. They're scared. They're in pain. They're not hearing me because their pharmacy's got them drunk up here with other listening apparatus, it seems. So what I get to do then is use my information to fill in the gap between where they want to be, which is pain-free, and where I want them to be, and where they currently are, and what's in the middle, and then what am I going to do about that? When you can bring clarity about the information that's being presented in their body, and also you're so calm, not arrogant, not agitated, not hopeful, calm, like this is what's needed. I know exactly what to do. And you've literally hot seated yourself with that information. They'll feel your assurance. When you're self-assured, they'll feel self-assured. They'll feel your self-assurance, even if they're still a little freaked out. That's what they want more than the diagnosis. And when you say, I think it's your knee, I think it's this, I think it's that, I'm going to urge you to stretch beyond that because your thinking is not where the answer is. The body is going to tell you what's going on, which is an open form of listening that doesn't come from a book. That's advanced skill to let the body tell you. And when the body is telling you, the body's telling them. And when you can be the translator, they're experiencing your clarity, experiencing your clarity. And that takes practice. So those are the 3 things I would offer you. Did that support you? Okay, good. Great. We have time for another question. Anybody have another question? I got an answer. I always got an answer. I always have information to share. Anybody have any other questions I can support you with today? Gary, coming for your mute button.
Yeah, this is new about the processors. So could you just, within time, briefly run over what those 4 are?
Yeah, briefly, I will.
Okay.
And also, I'll share with you
Yes.
that we do talk about them. I do talk about them in other training, and I also talk about them in our leadership, which is also on offer on Mondays. So it's a leadership concept It's not a communication concept, although it definitely fits in the realm of communication for sure. And it was game changing for me when I learned this. So I absolutely teach all of my Schatz method practitioners because it was game changing for me. It's game changing for them, and we get to get on with it. So the four processors, very briefly, are, I need to say this, while they're wildly different, they're also interdependent, just like because it's us, guys, right? Like it's us. So you might recognize that you're one or more, and you are. And the goal is, while we all have a primary and a secondary, the goal is to be equally balanced in all four so that no one can actually tell. If you come to a training with me and it's so clear to me what your primary is, I know there's room for growth for you because you're only operating 25% of your capability of communicating and listening. So the goal in leadership is to flex, we call it, into all four quadrants, where literally in one conversation, you're like, I don't know, were they this kind of processor or no, they were that kind of, no, wait a minute. So you can't quite tell because they flexed into all of them. And that's the sign of a good communicator because that means that they're reaching every single person that's listening. If they only come out one way, you know this actually. I'm going to answer your question, Gary, but you guys know this. When you listen to someone talk and you're like, oh my God, the sound of their voice. Oh my God, they just take a breath already, or whatever your complaint is about the way they talk. Or maybe they're like super quiet and they're super monotone and they don't really look and they kind of look down. You're like, could you please have some confidence and speak up? Like whatever your thing is when you're listening to someone is the indicator that they haven't flexed. Those are sort of effects about the way you communicate. It's not the best example I could have given, but if you recognize that someone always sounds hard and you never hear their heart, they haven't flexed because those are two very different processors. If someone's only giving you data points, only giving you outlines, bullet point, bullet point, bullet point, bullet point, and they never make it fun or tell a story, they haven't flexed. And that's what I'll share with you. One operating system is very story, very fun, very all over the place. And like you're like a moth to a flame. But you walk away from that conversation, you're like, did I learn anything? Not sure. The next type of operating system is really compassionate. They feel like you're by a warm campfire and everything's good. And you walk away from that conversation and you're like, actually, that felt nice, but nothing shifted. Because they're not going to be the type of person that's going to shift you into motion, right? The third type of processor is very analytic, very in order, very checkboxy. They love bullet points. Everything's color coded and detailed and organized, but you won't feel their heart while they're talking. So like, yeah, you gave me the data, but Jesus, I'm a human here, right? That's the mistake that operating system makes. And then the fourth type is the one who can see very big picture and sees all things all the time. And that's great because they will definitely get you to win the game. They'll see the treatment plan as it's rolling out, but they will often come across as like being over somebody or beyond them, like leaving people in the dust, steamrolling over them because they're already at the end zone while you're still like tying up your sneakers. So pros and cons to all of them. There's no one that's better. It's not a hierarchy. It moves like clockwise and counterclockwise. And the idea is to have a balance of all of them. You want to make it light and fun, not like it's a party when someone's in pain, but you want to be like, yeah, I get it. I so get it. And then really listen with heartfelt empathy, but don't get stuck there so that all they do is talk the whole time and you didn't get anything done. And you want to be organized in this happens before that happens before this happens, because this is how the body's wired. But you don't want to be so militant about it that you forgot there's a human in front of you. And you want to see the big picture. How do you win the game? How do you get the treatment plan results for you and them? And then not rush them in the process. You want to be all four. Always. It's a skill that's highly worth learning and developing. And again, that's why I teach it in so many places.
Thank
Okay,
you.
Gary, was that good? Did you get what you needed?
Yeah, that was
Okay,
very good.
beautiful. Operating systems for the win. All right, my friends, I appreciate you being here. Thank you so much for contributing to another rich conversation. If this training was valuable for you and you're here on YouTube, please do let me know that so I know what content to bring you next. And next month, we're starting with a new course in our club community. So we'll be starting, you'll see the newsletters and the email invites if you're on our list, and you'll also see the content that's coming up. And I'm very excited. It's going to be a powerful month. September. We have 5 Tuesdays. There's no mistake there. Okay, babes. Until I see you next time, have a great rest of your day and continue to do amazing work in the world. Bye for now.